Namaskar दोस्तों, welcome to channel Toxicology on board. Today in this video we'll be discussing another DABT topic, that is antibiotics, ototoxicity and nephrotoxicity. So let's directly dive into the question. So the question is, which of the following classes of antibiotics is most commonly associated with ototoxicity and nephrotoxicity? So we need to identify the class of antibiotics which are targeting both ear as well as kidney, that is ototoxicity and nephrotoxicity. So we have option A penicillin, option B fluoroquinolin, option C we have aminoglycosides, option D we have tetracycline, option E we have macrolides. The right answer will be in the green text, that is option C aminoglycosides. So aminoglycosides are the classes of antibiotics which are associated with both ototoxicity as well as nephrotoxicity. Okay, this question was taken from ABT recertification examination May 12, 2000. So with this question, we'll try to learn more in detail about the ototoxicity, the commonly other classes of drugs or chemicals which are causing this ototoxicity. Okay. So the main antibiotic class causing ototoxicity, which includes inner ear damage, okay, this particular part, leading to hearing loss and balance issues. Two things will be there. One is hair follicles will be disturbed, another which will lead to balancing issues and hearing loss are aminoglycosides and polypeptides. Under aminoglycosides, we have gentamicin, Tobramycin, and Neomycin. And under polypeptides, we have Vancomycin, which will have a synergistic effects with aminoglycoside antibiotics. Okay, coming to macrolides, no, we have erythromycin, azithromycin. These are the two macrolide class of antibiotic drugs that will cause reversible ototoxicity. Again, this is more of a serious concern when compared to irreversible toxicity, okay, affecting hearing loss or causing tinnitus, especially at high doses or in the case of neonates. So, children in neonates, you will find this type of reversible ototoxicity. Pardon, I think I was see reversible toxin. Once the drug is been the administration of a certain drug is being stopped, the ear function will regain back. So this is less harmful when compared to irreversible toxicity. So these drugs damages the inner ear cells. As I told you, they are damaging the inner ear cells, leading to potential irreversible hearing loss, and aminoglycosides being the most notorious. So, the kind of toxicity this aminoglycoside class of antibiotics are causing, that is an irreversible type of ear loss because they are damaging the inner ear cells. As a result, it is irreversible hearing loss. Okay, let's see what else we can see. Other major ototoxic antibiotic classes, aminoglycosides, they're highly potent. It means at very low dose they're causing this ototoxicity, causing both hearing, that is cochlear. You have if you look into the typical structure of anatomy of an ear, you can see this particular part cochlear damage is taking place, and balance. As I told you, here hair follicles will be damaged, that is vestibular damage, and this type of damage is permanent. So it is an irreversible type of damage. Examples we have gentamicin, Tobramycin, amikacin, Kannamycin, Neomycin, which is especially very toxic, and streptomycin. These are the examples of aminoglycoside class of antibiotics. Coming to polypeptides, we have vancomycin. Vancomycin, it is primarily kidney toxic, nephrotoxic. It can become ototoxic when combined with aminoglycoside, increasing the risk. So this is an example of synergistic type of effect. So the questionnaire can reframe it in a way that vancomycin, when used along with aminoglycoside antibiotics, so what type of toxicity will be there? Additive, synergistic, potentiation, like that options might be there. So we have here a synergistic type of toxicity is there. Basically, vancomycin, the target organ is primarily it is kidney, that is nephrotoxic, but along with that it is also causing ototoxicity. So we have example vancomycin, which is a synergistic. Then we have capreomycin. Then we have viomycin. Viomycin is prescribed for used for this tuberculosis. Okay. Coming to third example, that is third class is macrolides. Macrolides can cause temporary hearing loss. Okay, or tinnitus, usually reversible upon stopping of the drug. Once you stop taking this macrolide class of antibiotics, your ear can regain its function. Okay, examples we have erythromycin and azithromycin. Okay, let's see what else we can learn. Other related ototoxic agents, that is non-antibiotics. First two slides and the question was related to antibiotics. What if there are in the question non-antibiotics classes are given? What are the other classes or metals or other chemicals or solvents which are causing this ototoxicity? We will see. We have platinum-based chemotherapy, that is cisplatin, carboplatin. Okay, carboplatin is very ototoxic. Okay, as in the case of you have seen, I think aminoglycoside you have seen. No? Then coming to loop diuretics, we have furosemide, ethacyrenic acid, often worsens aminoglycoside toxicity. So if a loop diuretic is taken along with ethacyrenic acid, more type of damage it will cause. Salicylate. Coming to salicylate, another class is there. High dose of aspirin will cause tinnitus and hearing loss will be there. Okay, these are the other related ototoxic agents which doesn't comes under antibiotic. They are non-antibiotic. Okay, so aminoglycosides are the most significant antibiotic group for ototoxicity, with neomycin being the most toxic, while macrolides are a reversible risk. Vancomycin add to the risk when given with aminoglycosides antibiotics, that is synergistic effect. Okay, so let's summarize this one in the table. Okay, classes of antibiotics and ototoxicity. I have taken it from the CD summary. Casrat and Dowell summary notes will be there. From this, I have taken this table. We have antibiotic class, we have examples, type of ototoxicity, and the important areas they are going to damage. Coming to aminoglycoside, we have example gentamicin, streptomycin, neomycin, amikacin, tobramycin, kanamycin. What type of ototoxicity they are causing? They are causing permanent, that is irreversible, sensory neural hearing loss and or balance problem, that is vestibulotoxicity. So two types of cochlear damage will be there and hair follicles, that disturbance will be there. So we have sensory neural hearing loss as well as vestibular toxicity that leads to balance problem. And important notes with respect to aminoglycosides are they will damage often starts at high frequencies. Risk factors include high doses, renal dysfunction, and genetic predisposition. That is the reason our question had both ototoxicity and nephrotoxicity. Coming to second class, that is macrolides, we have erythromycin, we have we have erythromycin, and we have clarithromycin. Three drugs are there. In that, usually temporary, reversible hearing loss and tinnitus. Okay, ototoxicity is generally associated with high dose IV administration, particularly in patient with kidney or liver disease. Already, the patient is having these two type of conditions. Coming to glycopeptides, we have vancomycin, hearing loss, typically associated with multi-drug resistant tuberculosis treatment. So one of the drug we had in the case of polypeptides was used for TB, na? Often used as second line injectables, but associated with increased risk of side effects, leading to updated guidelines against their routine use. Okay, so that was, and what are the important consideration that we can take with respect to this this antibiotic type of ototoxicity? Irreversible and reversible. Aminoglycosides typically cause permanent damage to the hair cells of the inner ear, whereas ototoxicity from the macrolides as well as this vancomycin is often reversible upon stopping the medication. This is the take-home message you have to remember. Risk factors. The risk of ototoxicity is heightened by the factors. High dose is important, prolonged treatment, pre-existing hearing loss, kidney dysfunction, advanced age, concomitant use of other ototoxic medication, that is loop diuretics like furosemide. And genetic predisposition we have seen in the previous slide causes mitochondrial gene mutation, particularly in this A1555G, can make individuals highly susceptible to this aminoglycoside induced hearing loss, sometimes after a single dose. Even after a single dose, in this genetically susceptible individuals, no, this will cause more adverse effects. Okay, so thank you. Hope from this video you were able to understand about the ototoxicity, the class of antibiotics which are causing major classes and which part of the ear they are going to cause damage. And as you can see, examiner will not ask only one single target organ toxicity, will try to confuse you. In this case he has mixed both that two organ type of toxicity, that's ototoxicity and nephrotoxicity together is asking. Okay, and the options also, if you see, they'll try to confuse you. Okay, thank you so much. Be curious. For any questions, please comment, and you can always write a mail to arya.priyanka18@gmail.com. But I would also request you try to read a list of all the drugs which are causing drug-induced kidney injury, commonly used DIKI drugs. Make a list and try to remember them. Also, prepare a list of DILI, that is drug-induced liver injury. We all know that all these drugs, whether these antihypertensive drugs or these anti-diabetic drugs, no, over a period of time, long treatment, another for 5 to 10 years, they have some adverse effects either on the kidney or liver. So all this DIKA and DILI commonly prescribed, the currently which are used in the market, which have been prescribed to the patient. No, try to make a list of those drugs, and so that any question which comes around this particular concept, you will be able to address in the exam. Like, subscribe, and follow my YouTube channel Toxicology on Board. All the best for your exam.